For this chapter, a lot of this is going to be review in the beginning from A and P, so I want you to look this over on your own and do your review, and then we'll get into the nursing portion. Please make sure that you review the structure and function of the respiratory system. Make sure that you remember your terms. Here's some more terms such as inspiration, expiration, surfactant, atelectasis, understanding what that is. So how do we work at breathing? Compliance and airway resistance. Make sure to review about lung volumes and our pulmonary circulation. Here's your gas exchange. Think about some of the chronic diseases that can alter the amount of alveolar surface area. Here's a review here also about your oxygen transport and carbon dioxide transport. Cardiovascular physiology and how blood is oxygenated and carried throughout the system. The structure of the heart. Make sure to review about blood flow regulation. You have your stroke volumes, cardiac output. Remember, cardiac output equals stroke volume times your heart rate. Review your preload and afterload. Make sure to review your conduction systems and about sympathetic, parasympathetic, and your atrial and ventricles, and your SA and your AV nodes, the pacemaker, all those electrical impulses. And here's where we look at things that can affect oxygenation, such as physiological factors, and you have your conditions that can affect the chest wall, and influences of chronic diseases. Think about how anemia and hemoglobin affect. Oxygenation decreases as a secondary effect with anemia. Also to think about your oxygen carrying capacity of our blood and how it's decreased when we are around carbon monoxide, because it binds to the CO, creating a type of anemia known as functional anemia. Your hypovolemia, which is reduced circulating blood volume from either shock or severe dehydration. So now you have decreased circulating blood volume, and because there's lack of blood volumes, the oxygenated blood is not available for all the body tissues, and so we have what we call hypoxia, and so there's hypoxia to those tissues. And if we continue with fluid loss, the body tries to compensate by constricting the vasculature in the periphery and increasing our heart rate to increase the volume of blood to return to the heart, and it will increase our cardiac output. Oxygenation, too, remember, is decreased as a consequence of certain types of chronic lung diseases, and it can actually change the diameter of the chest, called a barrel chest, because of the overuse of the accessory muscles, and air trapping and emphysema patients. The diaphragm is actually flattened, and the lung fields are actually become overextended. And so you can have different degrees of hypoxemia or hypercapnia. Please review these terms. These are alterations in respiratory functioning. And we look at alterations in cardiac functioning, such as the cardiac output. Your left-sided heart failure is usually a decreased functioning in the left ventricle. And if it's significant, the amount of blood ejected from the left ventricle drops and results in what we call a decreased cardiac output. And so you'll see your patients with fatigue, dizziness, confusion, they get short of breath, and so they can end up with what we call tissue hypoxia from the diminished cardiac output. And since this fails, the left ventricle continues to fail, the blood begins to pool actually in the pulmonary circulation, causing some type of pulmonary congestion. So you'll hear the crackles in the bases of the lungs when we listen to them. Your patient will have shortness of breath on exertion, hypoxia, maybe have some dyspnea at night, that's sleep apnea, or difficult breathing at night, and cough. If you have right-sided, that's the right impairment of the right ventricle, and we usually see this from pulmonary disease or from some type of long-term left-sided failure, which now has affected the right side. Primarily, the factor of this is usually an elevated pulmonary vascular resistance. And so if this continues to increase, the right ventricle has to work even harder. And so it's going to require more oxygen for the heart. So the demand increases, and as the failure continues, the amount of blood that's going to go from the right ventricle decreases, and so blood begins to actually back up into our systemic circulation. These patients usually gain weight. They'll have their spleen will become enlarged, the liver will become enlarged. They'll have that dependent edema where the swollen feet and their neck veins are actually distended. We also have different types of valvular diseases. With some stenosis or regurgitation. Stenosis is when it's hardened and it's harder for the blood to go through that area, or a regurgitation where it doesn't close properly. Myocardial ischemia is the lack of blood supply to the myocardium, and it can't meet the demands of the heart. Angina pectoris is where they will actually have chest pain. It's usually left-sided or on the substernal area, and it will radiate to the left or both arms, the jaw, the neck, and the back. Most patients, we give nitroglycerin for this. If someone's having an MI, this is a heart attack. So on assessment, we're going to look for any impairments. We're going to cardiovascular, respiratory, review over their medications that they're on, any allergies. We're going to get a good exam, and then we're going to get our diagnostic and lab test. So these are some things that we're going to look out for in our nursing assessment. Please make sure to read through that carefully. On our physical exam, we have inspection, palpation, percussion, and our auscultation. Here's what we're going to look at. Health promotion, make sure vaccinations are up to date, such as the flu and pneumonia, especially those with the respiratory issues. Looking at their lifestyles, what can be changed, what can't be changed. The environment, pollutants and things like that can also affect the breathing. In acute care, we're going to try to manage their difficulty with breathing, keep up airway maintenance, and also help to move the secretions. We're going to think about hydration, humidified air to keep it moist, a nebulizer. We also will do cough and deep breathing techniques as well. It's very important that we get them to ambulate, move around, so that the fluid doesn't build up and settle in the lungs. keep them at a 45-degree angle, which is a semi-Fowler's position, to promote lung expansion and reduce the pressure on the abdominal diaphragm. We are going to use incentive spirometer to help with the deep breathing, especially for people who smoke or have a history of smoking. We want to inflate the lungs. We may have, for our patients with hypoxia, or to help prevent hypoxia, maybe get them on some type of oxygen therapy, nasal cannula, or through a mask. That's up to the doctor and the doctor's order. Sometimes we have to have supplemental oxygen for patients who have chronic cardiopulmonary diseases. We're going to make sure we have our safety precautions, such as no smoking, no petroleum, no petroleum jelly around, lip balm, that type of thing. We're going to look at supply of oxygen. Usually at the home, they have the home oxygen supplies, but you'll have the tanks or the wall piped in the facilities. Methods of oxygen delivery is going to be a nasal cannula or an oxygen mask. We have different types of masks right now in our class. For now, we're going to just worry about the simple face mask, and it's for short-term therapy. For patients who go home and still need oxygen, they'll have the home oxygen therapy. Again, it can be administered through a mask or nasal cannula. If they have a trach, it can go through the trach, and it's very beneficial for those who have chronic cardiopulmonary disease. And you've probably seen these people out shopping now. They could carry them around. For rehab, we want to make sure that we control their physical activity, make sure it's at an optimal health level. We want to also help with nutrition, helping them learn to decrease stress in their life and relax and take their medications, and how to use their oxygen correctly. The other things that we do, we want to do some respiratory muscle training for these individuals, and how to breathe and make it easier using incentive spirometers, and some breathing exercises with the pursed breathing and your diaphragmatic breathing. So we'll go over some of those in our lab, and also the deep breathing and coughing exercises. And here's some safety guidelines for those patients who have that oxygen and oxygen therapy. Some of these we won't need in this class. You'll need it in 212, but still look this over.